This one's for you, mamas. The ones that are out there getting adjusted during pregnancy, but have had no idea why they should be getting adjusted postpartum. Well, I've been there, and I'll give you a quick sneak peek. For starters, you basically just ran a marathon, and you are awesome for it. But do you think that marathon runners train really hard, run the race, and then just quit from there? No. They have a massive and detailed recovery plan, and you should too. You spent months preparing and training for your baby's birth, creating the perfect registry, reading all the books, maybe even creating a birth plan or goals. But right when your beautiful baby has arrived, you might be feeling surprisingly overwhelmed. And that's okay. You're probably physically depleted and wondering why no one warned you about how challenging the postpartum period would actually be. While most resources focus on labor and delivery, the reality is that the fourth trimester lasts far longer and receives just a fraction of the attention and support. This video is for new mothers who are struggling with physical recovery, sleep difficulties, breastfeeding challenges, or emotional regulation during the postpartum period, and who are seeking natural, drug-free solutions that support both their recovery and their baby's development. Today, I'm going to share why postpartum chiropractic care is crucial for both mothers and baby's nervous system health. You'll learn how birth-related stress creates subluxation and dysautonomia, how these neurological imbalances contribute to common postpartum challenges, and how gentle, specific adjustments can restore proper nervous system function, creating a foundation for optimal healing, bonding, and thriving during this critical transition time. Let's start with some stats. It's estimated that approximately 10 to 20% of mothers experience postpartum depression, highlighting its significance as a public health concern. Yet, this statistic only represents the most severe end of the spectrum. The reality is that most new mothers at some point feel unprepared for the physical and emotional challenges that follow childbirth, with studies showing that 70 to 80% experience some form of the baby blues. What's even more concerning is the physical toll of birth that often goes unaddressed. Research has documented that during delivery, a baby experiences significant compression and twisting forces as they navigate the birth canal, with pressures reaching from 120 to over 500 millimeters of mercury on a newborn's head and neck, an extraordinary amount of force on such delicate structures. These same forces create physical strain on mom's body too. And without proper neurological support, both mother and baby can struggle to recover from these physical demands. Let's talk about what really happens during your nervous system during birth. Birth is truly a marathon, both physically and neurologically, for mother and baby alike. For mothers, labor and delivery demand extraordinary physical exertion, with your body producing complex hormones while experiencing intense pressure, stretching, and sometimes tearing of tissues. I know we're getting a little detailed here, but these physical and emotional stressors can create what we call subluxation, areas where the communication between your brain and body become compromised. For mothers, subluxation commonly occurs in the pelvis, the lumbar spine, upper cervical spine, and thoracic areas, affecting everything from core recovery to hormone regulation. Understanding the postpartum hormonal cliff and its impact on your nervous system is something I want to address next. Within 24 hours of birth, your estrogen and progesterone levels, which are hormones that are elevated during pregnancy, plummet dramatically. This abrupt hormonal transformation is often described as falling off a cliff hormonally, and it profoundly impacts your nervous system. These hormones don't just affect reproductive functions. They directly influence neurotransmitters in your brain and the balance of your autonomic nervous system. When your nervous system becomes dysregulated during this hormonal flux, it can lead to difficulty sleeping, anxiety, temperature regulation issues, digestive disruption, and heightened sensitivity. Now, let's talk about the mother-baby neurological connection and how your nervous system affects your baby. The connection between you and your baby goes far beyond the emotional bond. It's a profound neurological relationship called co-regulation. Your baby's immature nervous system relies heavily on your more developed system for stability and organization. Studies indicate that babies depend on close physical contact with their mothers to regulate their heart rate, breathing patterns, body temperature, and stress hormones. That's why it's so important to have that skin to skin right after birth. But when your nervous system is regulated and balanced, your baby tends to settle more easily, feed more effectively, and develop more securely. Conversely, when you experience nervous system dysregulation, your baby often exhibits signs of distress because it's feeding off of you, and it creates a challenging cycle. So, how common are postpartum challenges, and how can we connect that to your nervous system? Breastfeeding difficulties often involve nervous system function, particularly the letdown reflex, which depends on optimal vagus nerve activation. Sleep problems, a nearly universal postpartum challenge, are deeply connected to autonomic nervous system balance. A nervous system stuck in sympathetic dominance, which is like your fight or flight mode, makes it difficult to relax into deep restorative sleep even when you're exhausted. Postpartum mood challenges represent perhaps the most significant intersection of neurological, hormonal, and psychological factors. Physical recovery complications like persistent pelvic pain, incontinence, and diastasis recti often have neurological components that extend beyond simple tissue healing. So, how can a neurologically focused chiropractic care support your postpartum journey? Our approach begins with comprehensive insight scans, and I know you've heard us mention these a lot, but they're going to provide objective measurements of how your nervous system is functioning. These scans serve as a window into your nervous system, allowing us to pinpoint exactly where and how subluxation is affecting your neurological function. And then it goes to gentle, specific adjustments, which will help restore proper pelvic function, reduce neurotension in your upper cervical spine, enhance nervous system communication for hormone balance, improve sleep quality, support proper muscle engagement, and promote optimal breast tissue drainage. For your baby, gentle pediatric adjustments use pressure comparable to testing the ripeness of a tomato, light and precise, to release this birth trauma tension and support optimal development.